Hello and welcome back. In chapter 14, we're going to be talking about substance addiction and families. So, substance use disorder is a long-term devastating effect on families. It disrupts healthy family dynamics, increases the likelihood of family members which suffers negative physical and psychological harm. A lot of times, we're going to talk about in this chapter, we're going to talk about how substance abuse can impact the family, how family members can play a codependent role in a person's addiction, how families can enable and not know, right? How certain parts of the family dynamics can play huge roles to influence on the substance abuse, and how the substance abuse can actually impact the dynamics of the family and the mental health and physical health of other family members. So, system theorists strongly believe that the concept of homeostasis, the tendency of systems like families, are how they balance themselves in response to change, right? So, in terms of the structure, the family is viewed as an organism surrounded by um, a set of rules determining how people interact with those both inside and outside the family, around the family, any external supports with the family. A healthy family structure is one that allows for flexibility and has clear boundaries set. So addicted family dynamics, when we talk about homeostasis, in families where substance abuse disorder is present, the disorder threatens families' homeostasis, the ability to balance itself out, right? People who become addicted to substances demonstrate clear patterns of behavior that socialize with others. Family and friends who do not use are excluded. Denial is frequent, and family relationships become very strained. So once the family stops attempting to return to the system of homeostasis, other family members adapt to the substance abuse behavior in an effort to return to balance, meaning they can enable and take on certain roles that the individual that are suffering from the addiction was having or whatnot to balance things out and allow that person to continue to use or things to get back to normal or that state of homeostasis. Boundaries delineate the ways in which people relate to others. They govern the rules surrounded by how close family members can get to one another, how the family connects with this larger social system, and how conflict is tolerated. People like to know how they're supposed to act and respond to others in terms of their roles or their family dynamics. In healthy family systems, roles can range from general to specific, but ultimately differ based on gender, culture, and the individual family itself. So while there are roles variations in addictive family systems, there are four main roles that children can occupy: the family hero, the scapegoat, the lost child, or the mascot. All families have rules that help organize family life. In healthy families, both overt and covert rules tend to be present, logical, consistent, and designed to promote growth. Rules in addictive family systems tend to have arbitrary, illogical, consistent, and punitive, tend to be punitive. There are three major roles that characterize addictive family systems. First, addicted drug use is the most important thing in the family's life. The addict is not responsible for her or his behavior, and the drug is not the cause of the family's problem. And the status quo must be maintained by not upsetting the routines of the family. So, stages in addictive family systems: we got denial, home treatment, chaos, and control. Those are the four stages of the addictive family system. In counseling, treatment success is frequently dependent upon the stage that the family and the addicted individual is currently experiencing. So, parenting in an addictive family system. Substance use disorder makes good parenting difficult, if not impossible. Parents who are alcoholics demonstrate less positive communication with their children, are less likely to display positive affect, are less satisfied with being a parent, and frequently engage in more punitive behavior due to their use, due to their level of dysfunction that the use is causing. If both parents abuse substances, it significantly impacts the home environment. Children's development can be negatively impacted, and they may not experience feelings of security, nutrients, or acceptance. While parenting is more difficult when there is a person with a substance use disorder in the family, The non-abusing parent can have a buffering effect on children living with addicted family as they try to, again, fill that role and create that homeostasis that we discussed about in earlier slides. So let's talk about how substance abuse disorder impacts on a relationship for couples. Partners report higher levels of physiological distress, including fear, anger, loss of security, and betrayal, physical symptoms, um, headaches, insomnia, and stomach problems, and communication problems and financial burdens within a relationship when their partner has to struggle with a substance use disorder. The quality of the partnership is also correlated with the presence of addiction problems. Alcohol and marijuana also appear to play a major role in interpersonal violence. Addictions can impact divorce rates for many couples. While addiction clearly affects the relationship, some researchers are trying to determine if the relationship itself influenced addictive behavior. Again, there were studies before that correlated addiction um, to bonds, where someone can bond with the addiction because with a substance or whatnot, because that substance is going to be consistent and give them consistently what they're looking for. Where a relationship they might not get that, right? For example, a problematic marital interaction can stimulate drinking or even be brought about by renewed drinking. When people have difficulty obtaining intimacy, they want to avoid conflict. They frequently draw a third person or an object into their interaction. And this way, they are no longer forced to deal with each other rather than concentrate on additional personal objects like substances. When addiction is removed, relationships can suffer as underlying issues of trauma, depression, excessive bringing and purging with food, or anxiety can increase. So let's talk about codependency or enabling. That's something I talked about when we opened up the chapter. Codependency is excessive dependence upon a loved one by a person who looks to external sources for fulfillment. It is exemplified by inadequate or loss of identity, neglect of self, or low self-esteem. This can be coming from the person that's actually in use or the person that is supporting the person that's in use. A codependent person will rescue others at the expense of their own needs and use control as the way of distracting attention from those who need it. They are obsessed with the loved persons and often believe that their survival, theirs and their partners, depends on maintaining their relationship. So enabling is when a partner inadvertently maintains the drug or alcohol use. Examples may include minimization, excuses, and denying the existence of the addiction. Enabling behavior may also result in non-addicted partners attempting to control both the addicted person's behavior as well as their surrounding environment of the person. So let's talk about how partners can be resources. Partners can serve as important motivators for their significant other to change their addictive behavior and can be a great assistance in counseling as they help and model and be a support and actually recognize their own enabling or codependency or whatnot and limit those things that can help change in the partner. Sobriety or even a reduction in substance use or addictive behavior can increase intention in a couple's relationship after the honeymoon period is over with. One major reason is the increased tension is the need for forgiveness. Although substance use disorders affect the entire family, children are most affected. All of our family members, children have the least control of what happens and really have freedom to leave. And also, he's talking about children that before birth, fetal alcohol syndrome or things that can happen to a child that's born into addiction based on use when they were actually being carried. Another way children can be affected is the growing up as an addicted family is characterized by chaos, uncertainty, and ever-changing reality. Coming from those adverse environments can impact their learning, can impact the way they see others, can impact their social environment, can impact the way they create boundaries with others and whatnot, right? So again, it's really important to understand how developmentally that substance abuse can impact a child's development. Violence is another yet a way children can be affected by addiction. Parental substance abuse disorder is a risk factor for child abuse. Sexual abuse is also frequent, but for different reasons. Behavioral outcomes. Children of substance abuse abusing parents go on to lead normal lives. It is important to know that about the negative outcomes that can appear. Like effects of living in addictive family systems can include lower cognitive performance, attentional deficits, and learning disabilities. Psychosocial outcomes. Children development can also be severely disrupted with actually how they respond to others, how they can actually develop relationships, right? And children often find themselves gravitating to the specific family roles we talked about earlier: the hero, the scapegoat, the lost child, or the mascot, right? And they don't develop the coping mechanisms that they need to actually to develop and have normal development and healthy development. The identity stress model may be one answer to the question of why children with coming from families of addiction will not go on to lead relatively normal lives. Children of alcoholics, right, develop the defensive self, one that can decreases their vulnerability. A defensive self includes denial, perceptual, and cognitive distortions of fear of losing control, um, black and white thinking over responsibility, and a negation of self. Parents with substance abuse disorders are unpredictable and sometimes abusive. They frequently discourage normal processes of developing, including autonomy, desire for affection, and creation of critical thinking skills. Attachment is to such parents lead itself to splitting, black and white thinking, in an effort to accept conflicting feelings about addicted caregivers. Children may blame themselves. Consequently, they often fail to develop appropriate pro-social skills and find it difficult to have positive, trusting friendships and increase risk for maladaptive relationships. And research has consistently found that including families in substance abuse use disorder treatment significantly contributes to improved treatment outcomes and has been found superior to other modalities. I currently run a facility, residential facility, and part of our interventions is family interventions where we bring in families and we train those families and teach those families on the effect of codependency and enabling and family systems and whatnot so they can be a better, healthier support and create a healthy neural network for their loved one that they're visiting. And it seems to be a very effective strategy. So assessment of addicted families, including deciding whether family counseling is appropriate. So some research suggests that examining the impact of substance use of the family. Counselors are encouraged to conduct multidimensional family assessments. Cultural competence is another important assessment and consideration. Many practitioners advocate that the use of formal assessment instruments during the initial sessions. Others maintain that structured clinical interview is the best. One assessment technique often used is the genogram because the genogram gives a whole picture of that whole family dynamic and go back to generations or whatnot, showing different patterns, showing different events, and that can attributes. At least three generations is what we want to try to capture. Treating approaches for addicted and family systems. Within the addiction treatment community, there's a debate around the idea of full sobriety. Current treatment can also include non-abstinence and harm reduction goals. During family therapy, counselors assist families with modifying these processes that undermine the family's functioning and its ability to support sobriety. Multidimensional family therapy, MDFT. I had a certification in this, guys. It was very effective. It's a treatment approach which is generally designed to treat adolescents with SUDs and their families. This outpatient family-based approach integrates family therapy, individual therapy, drug counseling, and system-oriented interventions. I was seeing these families from 3 to 4 times per week doing home intensive home-based services were not using MDFT, where the parent was very played a huge role, as well as the client played a huge role. When I was doing individual sessions with the family, with the parents, the kids, and then having family sessions, which considered about 3 or 4 times per week. It is manualized, evidence-based program that focuses on 4 areas: parenting skills, personal functioning, parent-adolescent communication relationships, and family members, as well as social systems interactions. Family behavioral therapy is outpatient evidence-based therapy treatment that combines behavioral contracting and contingency management. And brief strategic therapy was designed to help families who have youth struggling with behavioral issues. And that concludes our lecture on chapter 14.